Good afternoon, everyone. My name is Aleksandra Gawlik-Lipinski. I'm a PhD candidate at the University of Leicester and a nurse by background. I will be talking to you today about my study that is looking at the incidence of pediatric asthma mortality, life-threatening asthma, as well as prevalence of the uncontrolled asthma in children. So the background to the project is that asthma is a very common chronic disease causing airway inflammation, presenting with symptoms such as chest tightness, wheeze, cough, and shortness of breath. It affects approximately 1 in 11 children in the UK. We do have treatments available for asthma, but despite that, children in the UK do die. NRAD report in 2014 revealed that there were 28 children and young people deaths over a period of 1 year, and also revealed that 65% of the deaths were avoidable. They made several recommendations, yet in 2018, UK was still listed among countries with the highest rate of CYP asthma deaths, and the National Child Mortality Data report from last year also revealed that 54 children died over a period of 4 years' time. So we do have snapshots of what was happening, but what is the trend was my question, and what can be done about that. So the aim of my study was to explore trends in childhood asthma deaths, life-threatening attacks, and we used ICU admissions as surrogate for life-threatening attacks, and also poor control over the last 20 years in England. It is a retrospective cohort study using the data from clinical practice research data links, so that's routinely collected data from general practice that can be linked to hospital episode statistics that gave me information about the ICU admissions, Office of National Statistics for mortality data, and the index of multiple deprivation. Just going back to CPRD, it's a database that is broadly representative of the UK population. There are over 15 million of active patients there that are reflecting 23% of UK population. We included patients aged 5 to 21 that are registered with GP practice and contributing data to CPRD and have linkage to HES and IMD data. And now the results, and it's unpublished data. So there were 113 deaths between 2002 and 2022 with mean incidence of 0.2 per 100,000. What we have noticed is that some children were disproportionately affected. So 21% of children were of non-white ethnic background, as compared to 12% in the general asthma population. 39% were from most deprived areas, and compared to 24% in asthma general population. There were 1,955 ICU admissions with mean incidence 4.3 per 100,000, and again 33% of children were of non-white ethnic background, 34 from most deprived areas. When we conducted the generalized linear model regression and looked at the trends, we have noted that there are significant positive trends in asthma ICU admissions, with admissions increasing by approximately 7% per year between 2008 and 2022. And that was statistically significant. When it comes to pediatric asthma mortality, the news were a little bit better because there were negative trends with approximately 5% decrease per year between 2002 and 2022. For uncontrolled asthma, so we defined uncontrolled asthma as any exacerbation that required presentation at GP practice, A&E department, required hospitalization, or had to be treated with oral corticosteroids, or patients that required multiple reliever therapy inhalers. We have discovered that the prevalence of uncontrolled asthma in the asthmatic population is the mean is 16%. There was a slight decline in the prevalence over the years of approximately 0.25% per year. What is interesting, though, is when we stratify the data by various characteristics. So children from the most deprived areas are the most affected, and the ones that are from least deprived areas are least affected. The disparity between those, however, has widened over the years. Children from South Asian ethnic background were more affected. When it comes to regions, northeast of England and West Midlands had the worst outcomes for asthma. By age groups, in the last 15 years, children aged 5 to 11 were most affected by uncontrolled asthma. And in terms of the distribution between the sexes, 58.3% of children and young people with uncontrolled asthma were males. However, over the study period, we did notice that over the last few years it has switched, and more females are affected by uncontrolled asthma. So the conclusions are negative trends in asthma mortality, positive trends in asthma ICU admissions. Children from certain ethnic backgrounds are more affected and disproportionately affected, and so are the children from most deprived areas. Uncontrolled asthma trends remained broadly stable over the years, with only slight decline, and certain regions of England are also disproportionately affected. Targeted interventions in these cohorts should be considered. There will be further studies, case control study, looking at the specific risk factors in the affected groups, and hopefully it will inform future risk prediction tool. I wanted to thank all of my supervisors, collaborators, and funders. Thank you.